patient at a government clinic, it will now be easier to collect your chronic medication. All you need to do is arrange with the clinic to have your meds sent to your local post office. The South African Post Office is making these services available at its 342 branches in all provinces except the Western Cape. Dr. Mariette Ekstien from the Pharmaceutical Society of South Africa joins me now to give us their reaction to the developments. Doc, thank you very much for your time. I believe you're not in support of this?
Good afternoon, Masejo. Yes, indeed. It's very difficult to understand from the point of view as a healthcare professional how this could be in the best interest of the patient. Pharmacists are properly trained in the management of medicine. Our facilities are properly governed by the South African Pharmacy Council to adhere to ideal conditions to ensure that medication are kept safe under the correct storage conditions to ensure that it's effective medicine that ends up in the hands of the patient.
So the health department was speaking to us on this channel a little earlier on, and they were saying that, you know, it's actually not going to be, they're only going to be distributing the medication. They will not be dispensing it. Does that make it better?
So, not at all. So I do understand that it was also my conclusion that the dispensing will take place at a government facility or a government clinic, and it will be distributed to these post offices for collection by the patient. However, my concern is, and it's the concern of the Pharmaceutical Society of South Africa, that phase 3 of dispensing is when the pharmacist or the authorized staff member, like a pharmacy support personnel, can cancel the patient on the medication, whether it's repeat medication or not, to determine whether the medication is still effective, it still meets the needs of the patient is still being able to adhere to this medication, and that it's still safe and effective for the use prescribed and intended. So at the South African Post Office, I'm not convinced that there is an appropriate staff member that can adhere to this phase 3 of dispensing.
All right, and we all know that, of course, you know, as their core business mandate is logistics, they have kind of not performed very well in many aspects. So I do understand your point. And I know that you have another concern when it comes to, for instance, service delivery protests, where people aren't able to make their way, for instance, to a place like the post office. Also, the post office is very prone to, for instance, robberies.
Masejo, indeed. So that is one of the criteria when you look at a facility in terms of a pharmacy. And our good pharmacy practice rules stipulate a number of minimum standards that a facility must adhere to in terms of security, access to the premises, controlled access in terms of workforce that might have access to the dispensary or to the medication, appearance, waiting areas, consultation areas, etc. So it is deeply concerned for us as the PSSA that the Department of Health didn't reach out to the pharmacy profession and offer this very same service through our network of community or hospital pharmacies, which is a much better option. It's much safer. We are ensured about the control and the storage conditions of medicines. These facilities are already regulated by the South African Pharmacy Council. So, in our opinion, why sidestep the profession that are known to be the custodians of medicine?
So basically you're asking just, if only they just, you know, at least consulted with your profession to understand and maybe trained through you or employed some people in the pharmaceutical profession to be at the post office to ensure that these medications are at least stored in an adequate manner.
So, Masejo, no, that is not my only concern. So my concern is not that it's the post office and please put a pharmacist there and the problem is solved. It is much more than that. There is the number of regulations. Let me use an example. If you are a patient on insulin, I assume, Masejo, you would like to have comfort in the fact that the supply chain and the cold chain process,
not broken.
that's what you have to. Because if it's not, that insulin, you can go on and inject it, but it will not work properly. And you might think your condition is deteriorating, and your prescriber might go and increase your dose because the results he's seeking is not being reached. In the meantime, it's a problem product that was not properly stored, handled, or transported. And the other issue that goes with this hand in hand is the healthcare professional. I mean, pharmacists go through quite an extensive training process in order to have the mandate of working with medicine and looking after patients' medication needs. And I'm quite concerned that in terms of the media release or the articles by the post office saying that they've trained staff, I'm quite concerned about the level of training, because training and training facilities and training providers must be, in terms of the regulations to the Medicine Act, be accredited with the South African Pharmacy Council. So will these trainees be registered as at the South African Pharmacy Council? Because at the end, we would like everybody to be fully aware and take responsibility for handling medication. And if these individuals is not properly trained through accredited training, registered with the South African Pharmacy Council, how will there be disciplinary action in the unfortunate event of a medicine error?
Yeah, let's just hope that maybe, I mean, I'm trying to be the positive one between us. Let's hope that maybe government is only going to allow the post office to have medication that is not as sensitive as, for instance, your insulin, etc. But are you foreseeing another crisis at the hands of government when it comes to healthcare in South Africa, if they go ahead with this step?
I think the crisis that we will face is that the whole uphold of the profession, whether it's the pharmacies, you know, community pharmacy industry, or a hospital pharmacy, as well as every single professional, will actually be erased and be made null and void. Because the message that I'm worried about, the Department of Health is carrying out, is that medicines does not have to be handled by a trained professional and does not have to be kept in a recognized and registered facility. And that will become chaos and a disaster for healthcare in South Africa.
All right. Well, thank you so much, Doc, for speaking to us here on All Angles. We all know what's happened in South Africa when it comes to healthcare, etc., and basically the needs of people. So hopefully this will not become the crisis that Dr. Mariette Ekstein from the Pharmaceutical Society of South Africa thinks it could become.